and Namaste. This is Dr. Srinidhi Chidambaram, and I'm delighted to welcome you to the COVID Care series presented by Apollo Hospitals. The COVID-19 pandemic seems to be going on, wave after wave, from 2020 to now. We have been dealing with not just the COVID-19 infections, but all the associated restrictions to normal life. Anxiety rules us still. And in some ways, now it is even more challenging because we are now moving to the stage of living with the virus and not confining ourselves to grand isolation and lockdowns. The only way to successfully go back to our daily lives and yet remain safe from COVID 19 is to meticulously follow precautions. It's easy to rattle them off, you know it, but it is difficult to keep remembering and practicing precautions every single day, which is important to ward off the virus. Even one single act of carelessness or forgetfulness exposes us to risk of infection. So today, we are going back to the basics. So let us spend some time in this session to refresh our memories, learn what is new, and discuss the key aspects of preventing COVID 19. For this session, I am delighted to welcome Dr. Ravindra Mehta, who is going to discuss about COVID-19 safety protocols and refresh our memories. Dr. Mehta is Senior Consultant Pulmonology, Interventional Pulmonology, Critical Care and Sleep Medicine at Apollo Hospitals, Bangalore. Dr. Ravindra Mehta did his MBBS from the Seth GS Medical College and KEM Hospital, University of Mumbai, followed by an MD in Internal Medicine from the Lokmanya Tilak Hospital in Mumbai, then proceeded to the USA, where he completed a second MD in Internal Medicine from the State University of New York at Brooklyn Downstate Medical Center. In the US, he also did his fellowship training in multiple fields, which includes pulmonary medicine, critical care medicine, sleep disorders, medicine from the Winthrop University Hospital in New York, followed by training in interventional pulmonology in New York, Boston, and France. He has established a state-of-the-art interventional pulmonology program regarded as one of the leading programs in the country and the first in Karnataka. This has led to some groundbreaking work in interventional pulmonology presented in several international meetings. He has several professional memberships and authored over 50 professional papers and abstracts, written chapters, reviewed articles for professional journals. Welcome, Dr. Mehta, and I'm delighted that you were able to join us here to refresh our memories. So let's begin at the beginning and let's talk about what are the what can people do to protect themselves from COVID-19 infection, especially in this new wave, which appears to be a little blurred and mild.
Right. So I think, first of all, the concept of trying to do a refresher makes a lot of sense because COVID goes through the dual paradox of, oh my God, we've gone through a lot, we know a lot. At the same time, we keep forgetting what we talked about earlier. Yes. So now this third wave, which was much talked about after we went to the second one, the main thing was, is this third wave going to come? How is it going to be? And so on. When is it going to be? Well, it's come. It's on our heads right now. It's sweeping through the country with the metros being more involved. And then it comes down to what can all of us do at an individual level. First thing, we have to use the information and the understanding of 1.5 years to just calm down. There is more depth in the whole concept. There are more concrete messages, and it's easier to figure out what is the right thing to do now and what not to do. What can we do? What has not changed is that entity called COVID appropriate behavior, which at this point is dumbed down a little. Initially, when we started, we were afraid of everything, touching people, touching doorknobs, getting the newspaper guy, getting the delivery guy, and so on. Now we know in the third wave, we have to walk away from all that. COVID appropriate behavior comes down to two essential entities, masking and to an extent social distancing as much as possible. Masking is the mainstay. We have now realized whatever be the variants, which I'm sure you'll talk about a little later, the mask on your face tends to be the single final protection, which is going to make COVID, protect you from COVID. And that is still the most important thing. To repeat what we've been talking for a long time, it has to be what's called appropriate masking, which means that a mask is something over here. It is not a regulatory thing that you keep it here so that the next policeman or your colleague or somebody doesn't catch you. It is a proper barrier which is going to go over the nose and mouth so that when you talk, you breathe, and you cough or you sneeze, it's not going to put that aerosol into the air. So masking done the right way is the most important thing. The new thing in this variant is that this is a highly infectious variant, namely the Omicron variant. And so double masking is supposed to be much better. Single masking is not cutting it as well as it should. So first of all, appropriate masking, that means we don't take it down when we're talking and so on. But eating, when we're eating, we're conscious of the fact that we may be in an area people may have been there and the air may have some Omicron. So the mask should not come off unless you really have to. And double masking in public places, or preferably using a surgical mask with a cloth mask, would be the way to go till we write this over. You will ask us, do I have to do this indefinitely? The answer is no. At this point, with this more infectious variant, which we expect to hang around, say, for a month, month and a half, it's important to go the next level of precautions based on understanding. So appropriate masking, preferably double masking, preferably a surgical mask, is the way to go. Social distancing, nothing has changed as much as possible, but if you can't, the mask is supposed to be very good. Those of us who have the temerity and the strength to wear the N95, that's even better. You don't need two N95s, a single N95 is good enough. The new fancy mask available out there, sold through a bunch of outlets, nobody knows, but double masking is the way to go. So this in a nutshell is what's called appropriate behavior, simplified and made explicit. The second thing is the word you've heard a billion times: vaccination, vaccination, and vaccination. If you're not, do get your second shot. If your child who has now been included in the vaccination protocols requires it, please do it. If you have got fears, concerns, or worries about the vaccine, you should have a discussion with the right people, including healthcare authorities and others, and that should help you to dispel your fears. If there's any particular medical concerns, that should be dispelled also. And if you qualify for the Indian precautionary dose, so-called precautionary, or what's called abroad the booster, go ahead and take it. So that in a nutshell is how we should approach COVID-19. The rest of it, how do I go in specific circumstances, restaurants, office and all get simplified if you remember these 2-3 things which we've talked about later.
Little more about masks, because I mean you did say about the double masking and one cloth mask and one surgical mask. There are people who are still wearing these triple layered cloth masks. Is that supposed to be even protective, or should people only so at what circumstances will people use only cloth mask? Can that be worn at home, for example, or what is the protocol for wearing these masks when you're not going out to large gatherings?
So home is a challenge because on a theoretical platform, the second wave also had this issue. Home mask rationale is based on the fact that it's such an aggressive variant is there. It is so infectious. Aggressive in terms of infection, not in terms of severity. We'll get to that. And if there's so much of asymptomatic carriage, as I'm speaking now, I've kept the room empty so that no one's around with me. Then how am I going to protect my family members? Because all of us are going somewhere or the other, work, meeting people, meetings, school till some time ago, and so on. There is no right answer. The perfect answer is we have to protect each other by masks and so on. But probably when you live in a household, that's not easy. Practical tips: if there is any household help is coming, maids, drivers, cleaners, the like, those people should be double masked, and so should you be masked when you're around them. Whatever areas they go to, they should have a mask so they don't keep this aerosol over there in case they have asymptomatic infection, and that's very careful. As a corollary, in case they're symptomatic, whenever you can engage people from the outside, please ask them this question: if you have any symptoms of upper respiratory infection, defer the task if it is possible. The same thing goes to each one of us, that if we go out and we suddenly start getting symptoms, including headache, body ache, loss of taste, smell, and all those things, that means it is the inception, the beginning. And then we have to take precautions and protect our family members and the people who come to our house and the rest of the people in our ecosystem. Your ecosystem is all these areas: your work, your friends, your family, your extended family, and the people who come to work for you and the people you go to work for. All of them have to be protected. Practically, double masking, because it's cheap, it's possible, and it is not something which is you have to buy again and again. 2 cloth mask would be the least one would recommend, and then you can go up from there. So this in a general gives you the construct. The concern is that the day I get symptoms, already I may have put enough of exposure risk to the family or my ecosystem. So it's quite possible they are at a higher risk to do it. We can't avoid that at this time. It's impossible right now because the virus tends to be infectious -2 days even before I get symptoms. So that part is unavoidable, and that's why I started my session by saying some part is unavoidable, some part is reasonable, and some part one has to be very cautious about. So knowledge and a high degree of awareness and the willingness to go through this for the next few weeks and the long term in some measure or the other, depending on the information we get on these variants, currently is the writing on the cards.
So when it comes to actually, especially in this wave, what we have been seeing is that, people don't really, I mean, it's not like the earlier times when there used to be very clear-cut symptoms of fever and loss of sense of taste and smell. From whatever I can see, it seems to be more of even upper respiratory or sometimes just a cold, there's no fever. So what are the top symptoms now that somebody, should immediately, because there's a lot of people who ask things like, I have a cold, should I test? And then there's this whole thing about the home, the lateral flow tests also, which now people are keeping at home. So could you explain the concept? Because for many people, they don't understand at what circumstances we should do the home test, and then when do you need to do an RT-PCR and so on. So please explain that to us, Doctor.
So symptomatology and testing, two cardinal questions. Symptomatology is that of upper respiratory infection in general, and will come down to specific aspects. That means anything to do with this area, which means an itchy dry throat, a sore throat, a runny nose, both of them together especially, accompanied by sneezing episodes, fever, headache, body ache, loss of taste and smell, very rarely abdominal pain and diarrhea, or just not feeling well. So that's the constellation over there. So if that happens, there's two ways to look at it. One, I have allergies. My runny nose comes in this season, so I'm not too comfortable, and this happens to me. So if it's a regular allergy, then you may be able to take an individual call that it's an allergy. I took a medication, went away in 8-9 hours. This is not symptoms of respiratory infection or COVID-19. But anything beyond that which persists, especially if it is out of the way, it is persistent, as I kept on saying. Secondly, and I have been in an ecosystem where I can get infected, or anybody around me got infected, or I had exposure. If you put this constellation together, you will know that, well, this is out of the ordinary. I need to figure out this is COVID-19, and then comes the question of testing. Peculiar to this wave has been seeing the fact that scratchy throat, itchy, scratchy, irritable throat, sore throat, going to painful throat seems to be quite typical. With that, people are getting sniffly nose, blocked nose, runny nose. So this constellation is quite typical. Add on the fevers, people go from low grade, fortunately most of people have that, to high grade fever, and then the inevitable headache, body ache and fatigue comes with that. But to repeat, scratchy throat, itchy throat, sore throat, painful throat, and the runny nose seem to be part of this particular variant. In terms of testing so far is recommended as much as you can. So if you need to know for your own benefit and for the people around you, in the sense that am I going to infect an elderly person, a child, or my ecosystem, it's important to test. But testing has been a yo-yo. It goes from an early stage of the disease, when there are few people in the population, then you say test everybody, and the 3 T's, test, track, and treat come up, to now, when it is so rampant that the ICM, our august body, has also said that keep the testing down. You don't need to test everybody. Asymptomatics don't test at all. Screening don't test at all. Young healthy people don't test at all. To cut a long story short, symptomatology is what we've gone through. Testing, if you have access to it, do test, because knowledge is equal to ability to treat and ability to protect people around you. The good news is that this variant seems to be much milder than the older second wave Delta variant. So most people are doing very well. Now, which test to do? It's either the rapid antigen. Rapid antigen comes positive usually if you are symptomatic. It's not bad at all. The average statistics go 50 to 70%. But if you're asymptomatic, I mean, I just want to test every third day, it's not more than 30 to 50%. So positive rapid antigen ends the story. This is COVID. Go ahead and treat. You don't need to do an RT-PCR. A negative rapid antigen with a suspicion of respiratory infection, which may be COVID, still mandates an RT-PCR. So that is the way to go. In terms of access to tests, rapid antigens are available everywhere and currently highly unmonitored. You can go and buy it and do it yourself also if you have to. But the right way is to come into the system and take the right advice so that you are doing it under supervision of somebody who can help you with the results. Otherwise, you get into worry mode. So help you with the results, help you with what to do, analyze the risk factors, and recommend right approaches to the next step after this.
To go back to prevention again, now we will talk about a few special groups. So, what would you like to say to parents? Because now again, children are now, some of them are in the eligible group for their vaccination, but a lot of younger children, and there's a lot of, some schools are open, some are not, some exams are going on. So, what would be your top tips for children? For parents to tell
Children
their
have been a worrisome group because they're not vaccinated. So we assume and we believe and we know that vaccination is equal to protection from moderate to severe disease. And that's all we care about now, right? 1.5 years down the line, give me the little infection, no big deal, but prevent me from getting sicker, prevent me from getting into the hospital and save my life. That's what it comes down to. So once we integrate this thought process, then our thinking becomes easier. So vaccination in children has just been expanded to the later teenage group, and it's going to take a while to get there. The first shot is rolling out as we speak. So children will get infected as a worry. It's very difficult to protect children because they cohort, they will do it, and they don't have that sort of understanding. And already they've seen so much over 1.5 years being away from school. It's a tough life for them. It's not easy to be strict and punitive and harsh all the time. So you be reasonable and you educate them and try your best as much as possible to implement what we spoke about in this talk earlier. Vaccinate the children who are allowed to get vaccinated. That's the best thing to proceed for the short term and the long term. Lastly, some good news for you. The disease in children is mild. Even what we saw in the second wave, children are not as badly infected. And in this third wave, we are also seeing, sorry for this, that children are not getting infected too badly at all. Also, in the second wave, also when we looked at data, serosurveillance, we realized that despite not being vaccinated, in most cities, 85 to 90% of children had antibodies, which means, ladies and gentlemen, these kids got infected, no vaccination, and still did very well. So there's a big feel safe message for them. So again, do your best, reinforce as much as possible, follow the same precautions, educate them, make them leaders so that they themselves take charge of all this, especially the older ones guiding the younger ones. But at the same time, vaccinate whoever is eligible and understand that there's no reason to panic. Most of them, in fact, majority or maximal amount of children will be able to do this based on the original nature gift, innate immunity.
One aspect which we also speak about is the hand hygiene. So how relevant is it now? Because I know that hand hygiene, but also like earlier we were in this mode of, as you said, like washing vegetables, keep them outside, cleaning every phone, and like many phones were ruined, in fact, by flooding them with the alcohol-based sanitizer. So what is the current advice regarding surfaces and hand hygiene?
So hand hygiene is still recommended based on the fact that if I touch it here, I'll be carrying it and I can transmit it. But otherwise, it has taken a fair backseat compared to what was there in the original first wave. So first wave is fear that, my God, I move from here to here, I touch here, I'm going to get COVID-19 and my risk is higher. Now we know surfaces are not an issue. No need to go obsessively cleaning them. Doorknobs, door handles are not an issue at all. Yes, you must wash your hands from time to time, but the obsessive 20-second surface to surface not required. If you come in contact with something, you touch your hand here, there, it's important to wash it. So you would still recommend wash your hands 3-4 times a day, but extensive sanitizer application, repeated obsessive washing, repeated obsessive sanitization, the no touch, which was so strong in the earlier part of the pandemic, is no longer talked about. It comes down to keep it simple, keep it minimalistic. Masking, social distancing is the major way to go. Limited amount of sanitization compared to what? So no longer do you need to sanitize the whole house, sanitize the whole room, and so on. You just have to be reasonable about it and follow precautions like we've talked about. All this is easily available on all these standard sites also, like WHO, who has also amended the original recommendations.
So when it comes to social distancing or going out, now that is another thing which people are confused about, because if the person is young, vaccinated, there's no work from home exactly. Though there are some industries and companies which are still allowing that, but at the same time there are elderly people also, like people who maybe have comorbid conditions. So what is your advice to them, like on, even there might be even professionals like lawyers or doctors, elderly people, should they then be going out and practicing, or should they just go out for social gathering wearing a mask, or do they need to be, who needs to be extra careful, and does anybody need to just sit at home all the time?
Well, social distancing is not working very well as a general concept because crowding seems to be so common. And secondly, this Omicron variant is highly infectious. So the biggest tool you have at this point is responsible masking. So that's what we have with us. So if you really think you're at high risk for Omicron based on these particular characteristics, any gathering outside, you're at risk. And now we have a multitude of episodes where people have said, I had a party, this typically happened in December end, and a huge number of people from that party have been either symptomatic or asymptomatic infected. So I don't think it's easy to now say that get gatherings together, even though we may maintain social distancing, it should be okay. It doesn't happen. First of all, as an inherent concept, it's violated, and two, it is very, very infectious. So people who are really at high risk, if you go out, you can with responsible masking. Social distancing advisable, but I wouldn't depend on it. If you're the very cautious types who say I'm okay with this, then for the next X amount of time, which you think is a month and a half till this variant dies down, you may be better off precluding contact or gatherings till all this settles. This is the message at this point. The younger people, again, going out the same risk. It is impossible to give you concrete A, B, and C. Highly infectious. If you are out, you can get it. However, if you have to go out for any reason, wear responsible masks, have the next person also do that, transact whatever it is, whether it's work or personal stuff, and then try to keep it to essential stuff.
Is there anything else that you would like to tell our viewers about this wave, and anything that they should remember?
Yeah, so there's always the panorama part of it. First wave, lot of fear. We suddenly realize how beautiful life is. Extra precautions, everybody on high alert. After second wave, it's like a decompression. The whole well emptied out. People went completely outside, if I can use the crude word, berserk, and did whatever they had to do. Come second wave, it was crazy. We realized that this can be very bad, and the single ticket out of that seemed to be appropriate behavior to whatever time we can, to whatever extent is doable in a general worldwide spectrum, and the vaccine. Third wave, we are vaccinated, but this high amount of mutation and this early alert, South Africa takes the alert, WHO takes it high, and within 2 days flat, a word which was not known to known only to a few people like Omicron becomes a household word. But the good news is it's a mild variant right now. It seems to be not as bad as Delta. Like, for example, in a Bangalore-like city with 20,000 patients tests per day positive, we still are looking at reasonably low hospitalization, probably because of the variant and because of an extensive and amazing vaccination program. The watch message which I want to leave, this can't be a panacea for only feel safe, is that the last word is not written. Massive numbers and infections can overwhelm healthcare and facilities, which could include you and me. And we still need Indian data to come out. So till then, continue precautions. Heighten your precautions, be responsible, a citizen, not only taking care of oneself, but the ecosystem which we've talked about. See the writing on the wall, follow recommendations, complete your vaccination, and believe me, this too shall pass. It will ride over. We believe that this is now a tempest. It's not a wave as it's being called. It's a tempest. It should go up and down much faster. Already other cities are seeing a downtrend, and information from abroad is supporting it. So ride it out with responsibility so that you go through less stress. But by and large, this seems to be better than the second wave. No doubt, we want to leave you with this message of both feel good and responsibility. being two sides of the same coin. Thank you.
Thank you, Dr. Mehta, for a wonderful discussion. As the number of COVID-19 cases continue to rise and fall, Apollo Hospitals continues to make all efforts to ramp up and provide the 360-degree care. So if you have more queries, if you need any assistance, you know where to find us on all our social media channels or on Facebook or on the website or on the app. We are always there for you. So now take care, be safe, please follow all the COVID precautions, and we can win over this wave too. Thank you and namaste.